Let me ramble on a bit here tonight about fibrosis. Now, I've touched on this subject a few times before in a few other shows, but it bears retelling in a complete show. Fibrosis is one of the two major killers. The first killer is inflammation. The second killer is fibrosis. If you think about all the disease states that end in the word osis, they are technically a kind of a fibrosis condition. Now, some of the osises, like osteoporosis, can't kill you and really aren't involved with fibrosis, but other things like cirrhosis do have a fibrosis or a scar tissue component. And they build up this scar tissue. Now, you'll hear me use the term fibrosis and scar tissue interchangeably because the terms are interchangeable. Scar tissue is a type of fibrosis, and fibrosis is a type of scar tissue. It's tissue that isn't supposed to be somewhere, tissue in excess of what is supposed to be there. Now, why do we grow this stuff? Fibrosis is a natural part of the healing mechanism. Let's say you sliced into your finger. You grow that nice blood clot, and in the blood are these little fibers that look like powdered fiberglass, if you've ever seen that stuff. Little fibers that are in the blood, thickening it. And they're the stuff that causes the blood clot. The adhesion molecules glom onto the fibers, and the fibers glue themselves together, and you create a blood clot. Now, that fibrin lays itself across the wound in order for the epithelial tissue to grow from one end of the wound and the other end of the wound and meet in the middle of the wound. So it grows across this bridge work, this matrix, if you will, of fibrin to meet in the middle. And then what the body does is that it lyses away at the excess of fibrin, all the extra fibrosis, all the extra scar tissue that the body laid in to allow the epithelial tissue, the regular skin or the regular muscle or the regular soft tissue, to grow up over it and through it. It will eat away the extra using enzymes. The body's enzymes will eat away at the extra scar tissue, the extra fibrosis in the wound, leaving a very pliable, very soft, very strong, and almost invisible scar. Okay, you older folks know what happens as we age. Yes, your wound heals. Yes, you grow the epithelial tissue from one end of the wound to the other. But that excess of fibrin that the body put in there to create that bridge work doesn't quite go away. It stays there. And that knot stays hard. It stays inflexible. It can even grow more scar tissue and become what's known as a keloid, in which case it'll be knotty and bumpy and raised, enlarged, and unsightly, and this wound isn't exactly skin like it used to be. It's not very flexible. It's certainly very visible, and it's not very strong at all. If you take a look at what grows with decubitus ulcer patients, with people who've been in bed for too long and they have bed sores, it's mostly fibrin, and it's not very strong at all because it hardly has any epithelial content, so it re-tears very easily and very quickly. The fibrin in and of itself is not the maker of strong tissue. Epithelial tissue is what's supposed to grow there, not fibrous tissue, which is classified as a soft connective tissue. Okay, now that I've given you the background, what are the various types of fibrosis conditions that grow in human beings? Well, first and foremost, we have the age-related fibrosis. Fibrosis that grows inside of all of our internal organs, from our brain to our lungs, to the liver, to the kidneys, shrinking their size and diminishing their function as we age. And again, forgive me for retelling this, but an 18-year-old and an 80-year-old have substantially different sized organs, even if they're about the same size person. In the older person, the organs will be about 1/3 the size of those of the 18-year-old. The 18-year-old will have nice, juicy, full organs, and if you do a post-mortem on them and you slice into them, they feel like very firm jello, whereas the organs in the senior feel like an Italian bread that's been left on the kitchen counter for 2 or 3 days. It's kind of rough, very, very grainy, and not very easy to cut. With the growth of this fibrosis tissue, of this fibrotic tissue, inside your internal organs, inside your hollow organs, when that scar tissue takes up space in there, it diminishes the function of the organ, and it dries it out. If you can imagine a kidney, or a brain, or even a heart, because the heart can grow fibrosis on the tendons of the valves and on the flaps of the valve. The lungs can grow fibrosis, and the more space that's taken up by the fibrosis, the less expansion and contraction the lungs can do. The less contraction the heart can do. The lower the stroke volume on the heart. In other words, the less amount of blood that the heart can pump. So with the growth of fibrosis within the internal organs, you have a diminution in the ability of that organ to perform its job. And with that, you have a lowering of your life force, maybe the onset of disease, and you have a lowering of your ability to maintain your life functions. It's exactly like pouring sand into a clock. That clock might still work, but it's not going to keep good time, and it's certainly not going to be unimpeded in its work. The hands might get stuck going around. All the gears are going to get kind of gummed up, and things are just not going to work anywhere near as well as when there was no sand inside the clock. Now, two things bring about this growth of scar tissue in the internal organs as we age. The first is inflammation. Inflammation is the cause of fibrosis, and here's the process. We go through irritation, and the constant irritation causes an inflammation, and then chronic long-term inflammation, even low-level inflammation, causes induration, causes a hardening, and that hardening is a growth of scar tissue. And then induration leads to death. Now, as we age, we always get inflammation in our internal organs, from our brain to our livers, our pancreases, our spleens, our hearts, our lungs, our kidneys. Everything inside of us becomes inflamed due to the wear. Think about this. When your bicep gets tired of working, what do? You give it a rest. What about your heart and your lungs and your kidneys? Can you give them a rest? If they stop to rest, what happens to you? You're dead. They can't stop to rest. They have to keep on working. So they react to the stress by becoming inflamed. Any type of an infection can make this inflammation worse. Any type of trauma can make this inflammation worse. Any type of mental stress can make this inflammation worse. A friend of mine once told me that commuters who were going from places like Connecticut into New York City could expect to have 10 years taken off their lifespans just due to the stress of the daily commute. Now, if we exercise, that's generally a good thing, but exercise brings with it its own inflammation. So it's a good thing in that we're maintaining our muscle mass, we're maintaining our bone density, we are improving the circulation to our brain, our internal organs, our extremities. We're helping everything inside of us to work better, but it's also creating extra inflammation for our bodies to deal with. And we need to be aware of that when planning exercise programs, that we don't go overboard. For example, 40, 50-year-olds shouldn't be doing the exercise programs that teens and 20-somethings are doing, because it's like redlining your engine. And once you get to a certain age, you can't redline your engine down the gravel road. It will break. Your ball joints will break. Your steering will break. Your suspension will break. You're just like an old car. You treat an old car with respect. You may have it do an occasional trick or two around the track. You may rev it up and go real fast every now and then, but you don't give it a steady, constant diet of high revs and redlining. Next in our causes of inflammation is trauma. If you have a car accident, if you injure yourself performing a task or doing athletics, let's say you tear a hamstring, and then the hamstring heals, but can you touch your toes anywhere near as well after you had the hamstring injury as you could before? You're a lot tighter than you were, aren't you? It's really harder to reach, isn't it? And it really hurts like the dickens when you try to touch your toes at the exact point where the injury was. Fibrosis built itself through the hamstring, healing itself, and now you've got to undo those adhesions. Adhesions are the same as fibrosis or the same as scar tissue. You've got to undo those adhesions, get rid of that scar tissue. You literally have to tear it in order to get your range of motion back. Many folks are familiar with coming out of casts. Break an arm, have surgery on a shoulder or a joint, have surgery on a knee. What happens during the period of immobilization? That's right. Scar tissue builds across that joint. You know, these days, for knee patients, they immediately put them into a mobilizer and get the knee moving to try to prevent some of the buildup of scar tissue, because the scar tissue at the knee builds immediately post-op. Within minutes of the surgery being completed, the scar tissue begins to grow. Folks who have had some sort of an injury where they've been in a cast and the cast has involved having a bent elbow knows that when you try to straighten out that elbow, it's going to take weeks, maybe months of therapy to break through that scar tissue in order to fully straighten out your elbow. And I know some people who have suffered elbow dislocations who have never gotten their full range of motion back at the elbow because they didn't want to go through the pain of tearing that scar tissue via exercise and stretching. We have scar tissue buildup, we have fibrosis buildup after surgery. Let's say a person has abdominal surgery for whatever reason, C-section, or having your appendix removed or something of the like. Scar tissue will begin to build up immediately, and it can become extensive enough that it begins to bind down and strangulate the intestines and impede the function of the organs. If the organ function is impeded enough, there will be horrific pain. And then the surgeons go right back in and they open up a new surgical window and they cut away all that scar tissue. And what happens right after the surgery? You guessed it. You start building up more and more and more scar tissue. I know of one gal who had a C-section who every 2 years had to go back in and have the scar tissue cut. And one time, the gal surgeon cut into her ureter, the tube that takes the urine from the bladder and takes it out of the body, and she's been having trouble ever since. We see scar tissue build up with pulmonary fibrosis and emphysema patients. With these patients, the fibrosis grows over the alveoli, the little pockets in the lungs that suck in air and transfer oxygen to the bloodstream and transfer carbon dioxide to the blood. With many emphysema patients, their alveoli are so stretched out that they can't contract in order to perform the act of breathing. But with a good many of the emphysema patients, and with all of the COPD patients and pulmonary fibrosis patients, the problem is not that their alveoli are stretched out. Some of them are, but not all of them. The problem is that they've got scar tissue growing over the alveoli, and it's just like putting your hand over your mouth. You can't take a breath in. Likewise, all that fibrotic coating over the alveoli, those guys, little guys, can't get the air to transfer into the sac past that layer of scar tissue. With fibromyalgia patients, we have the growth of scar tissue like a spider web, three-dimensionally in through muscle. And this binds down the muscle. It also grows in the microcirculation, plugging up all the little tiny capillaries and venules, impeding circulation. So all fibromyalgia patients are suffering from something called ischemia. Ischemia is a condition where you neither get oxygen nor blood sugar to an area, so cellular respiration ceases and pain, unrelenting, uncontrollable pain sets in, a pain that cannot be taken away by pain medications. Heart attack victims know the pain of ischemia very well. We don't give heart patients pain meds because we know it's not going to work to take away their pain. Likewise, we have all experienced putting rubber bands around our wrist. What happened when you did that when you were a kid? First your hand turned an interesting shade of purple, maybe blue, and then it began to ache. And the more you tried to move your fingers, the more you tried to use your hand, the deeper and stronger the ache got, until that ache became a pain and the pain became screaming. You could have mainlined heroin right into the hand at that moment in time, and nothing would have happened to take away the pain. Nothing would have taken away the pain until you took off the rubber bands or you cut the string and you restored the supply of oxygen and the supply of adenosine triphosphate, the blood sugar, to the area, and it restored cellular respiration. That and only that could have relieved the pain of ischemia. So we have these fibromyalgia patients who, through inflammation or estrogen dominance, now we didn't talk about this before, I was going to touch on it, but I kind of forgot. Estrogen also is famous for growing fibrosis. We know this. It is a medical fact. So between the inflammation and the estrogen dominance that all fibromyalgia patients have, even the guys, we see this growth of fibrosis in muscle tissue, and that is what causes the pain. And since the pain meds don't work, most of the docs think, oh, these patients are crazy. And yes, up to 60% of people who have been diagnosed with fibromyalgia are actually Munchausen's patients. They are experiencing or faking this pain or this condition to get attention. But there are 40% of fibromyalgics who are actually true fibromyalgia patients, and they hurt like hell. Other forms of fibrosis, or what I collectively call the women's fibrosis diseases, these are endometriosis, uterine fibroids, fibrocystic breast disease, and ovarian cysts. These conditions, even the ones now called adenomyosis, are pockets of fibrin, pockets of fibrosis, either encasing the muscle wall of the womb, or fibrosis growing through the womb as an endometriosis. And I have to tell you, endometriosis does not stop at the womb. The endometriosis can grow through the entire body, even crawling its way up into the brain. You can go look this up. Endometriosis of the brain. Fibrocystic breast disease, where gals develop these fibrous cysts that become engorged with fluid. All of it is driven by estrogen. Every fibrosis condition, from kidney cysts to fibrocystic breast disease to the shrinking of the internal organs, every fibrosis condition is driven by estrogen. So part of controlling fibrosis is controlling estrogen. Part of controlling fibrosis is controlling the inflammation. And a great part of controlling fibrosis is to put in what the docs in the U.S. don't know exists, and what the docs in Central Europe have been using for 50 years to control fibrosis. Those are systemic enzymes. Systemic enzymes are enzymes that are taken orally, that are absorbed through the intestinal wall. And for those folks who want to argue with me that enzymes are too big a protein to be absorbed, go look at the absorption studies on enzymescience.com. There are over 200 peer-reviewed medical studies to prove not only the absorption but the therapeutic action of systemic enzymes. And I beg the case that if there wasn't any absorption, there wouldn't be a therapeutic action. The studies are both done on humans and on animals, so if you want to claim placebo effect, animals don't get placebo effect, horses don't get placebo effect, dogs don't get placebo effect, lab rats certainly don't get placebo effect. Systemic enzymes have been used to eat away, to lyse away at fibrosis since 1959. That's when the first systemic enzyme came on the market, and they've only been getting better and stronger since then. Central Europe has used systemic enzymes. Eastern Europe has used systemic enzymes. The Japanese and now the Indians have used systemic enzymes. The only folks who are still resistant to the use of systemic enzymes are American docs. Because American medical education isn't what it should be, but we've touched on that before, so I won't beat that dead horse again. About the only thing that medicine here in the States offers to try to help control fibrosis is the use of the corticosteroid drugs. These horrible, nasty, terrible, drugs create a myriad of side effects, from being moon-faced to holding water, to making your skin so thin it tears when you brush up against something, to making your blood vessels so frail that you bleed and you get black and blues from not bumping into anything at all. And I have to tell you that if your peripheral blood vessels are that weak that they hemorrhage when you haven't bumped into anything, what are the blood vessels in your brain like? What are the blood vessels around your heart like? Are they ready to burst? All these things, all these horrible, nasty things can happen from the use of corticosteroids. And that's the only thing that American docs have to try to prevent the formation of fibrosis, to try to control the inflammation which brings about the growth of scar tissue. Well, what if, with the same natural, non-toxic, safe substance, we can not only control the inflammation by eating away at the pro-inflammatory cytokines that cause the inflammation, but what if we could also eat away at the fibrosis that inflammation is trying to grow? Think about that. We can kill two major birds with the same stone. We can get rid of the itis and the osis. We can get rid of or control the two greatest killers of man: inflammation and fibrosis, with one tool. It is within the data in the research, and it is within my clinical experience, that we can give systemic enzymes to a PF patient, to a COPD patient, to an emphysema patient, and within just a few weeks, they're breathing deeper, their vital capacity is greater, their blood oxygenation, their blood saturation, their SiO2 is much higher. It is in the research. It is within my realm of clinical experience to use the systemic enzymes on fibromyalgia patients, to lyse away at that fibrin that's binding their muscles down, that's clogging their microcirculation, and their pain goes away in a matter of weeks, especially if they add exercise and magnesium to the mix. It is in the research, and it is within the realm of my clinical experience to use systemic enzymes with all of the female fibrosis conditions. With fibrocystic breast disease, actually that's an easy one. With uterine fibroids, with endometriosis, and with ovarian cysts. Now that's a little tougher one, because it's usually just the outer pocket of the cyst that is fibrin. Inside there's a lot of fluid, and there's also a DHT that we have to control, dihydrotestosterone, which is made from estrogen, not from testosterone. So the cysts are a little harder to get to, but we can still control them. It is within the research and within my realm of clinical experience that we can completely eat away at post-operative scar tissue in weeks and then keep it away. We have to remember the rule that wherever scar tissue has been, it will want to return, whether it's the lungs or the abdomen or a joint. Wherever scar tissue has been, it will want to grow again. So once you get rid of it, then you need to stay on maintenance to keep it away. But we can eat away at the scar tissue from surgery and prevent the need for further surgeries, which would only create more scar tissue. Using the magic of systemic enzymes, we can positively affect the outcomes of all these fibrosis diseases, of all these fibrosis conditions. Think of how much easier knee rehabilitation would be after knee replacement if we put in the systemic enzymes. Think of how you wouldn't have to rotor-rooter arteries out if you use the systemic enzymes to eat out the fibrin matrix that creates arterial plaque in the first place, and you use the same enzymes to eat away at the lipids that glom the heavy metals, the calcium, and the fibrin together. All you have to add in that case is about 1,000 to 2,000 milligrams of magnesium to chelate out the calcium in arterial plaque, and you've got the recipe for opening your arteries. And it will work in 3 to 6 months. Usually not any more than that is needed. With the old systemic enzymes, it would take up to 2 years. Dr. Hans Nieper used to talk about it taking about 2 years. It doesn't take that long anymore because the enzymes have gotten better. They've gotten stronger. They work faster. With the internal organs and with the aging and shrinking that happens, if we throw in the enzymes, it's just like taking a sponge that's wrapped around with steel wire and cutting the wire off of that sponge. If we then throw in either human growth hormone or insulin growth factor 1 or the things that cause the body to release or make IGF-1, we know the research is very clear that the internal organs regained some of their size. UC Berkeley did a study back in the early 90s where they injected human growth hormone into seniors. These guys were 60, 70, and 80 years old, and with all of them, their internal organs grew. We know that the combination of the human growth hormone and the IGF-1 along with the systemic enzymes helps to regrow the size of the internal organ, increasing their size and increasing and improving their function, and that means you get to live longer. So it behooves all of us to fight the inflammation that we're growing, the inflammation that grows in us, the inflammation that we're creating, and to fight the fibrosis that's trying to kill us, that's trying to restrict us, that's trying to make us smaller and diminish our ability to perform our activities of daily living and our vital life functions. And with that, I'll say good night, be well, God bless, and I'll be chatting with you again soon.